Thanks, Ravi, and entire team. Wow. And first of all, I would like to congratulate so many lovely ladies coming in here on a Sunday too. I know in India you'll get only half day off on Sunday. Even that day also you're spending here. So you'll go home much more enriched. And at the outset, so I know that today is one of the few days I'll be outshined. Even wearing my pink suit also, you look more colorful here, but still trying my part. So that's great. So I mean, this is Krishnaveni, we have to especially thank for organizing this kind of conference. This is the first time. Yes, you deserve a big round of applause. Madam has taken a lot of pains to organize this session, because finally everything looks good after or just attending, or just for me, like coming for 5 minutes, it looks very good. But the entire team has taken a lot of efforts for at least 1 month to organize all these things, including calling me also 10 times, I think, just to make sure I'm not missing. But all like this kind of, like we have specialists from, in addition to gynec and obst from all over the place, the leading luminaries, all of our all-star doctors also, Dr. Rajshekhar Chakravarti, Dr. Santosh is here, Dr. Venkat Kola is here, Dr. Ganesh is there, Dr. And every specialty, I think, is represented. This is one of the first times I'm seeing so many of our own doctors with so many specialties and top leading specialties coming and sharing their experience. Because I think this is, our all-star doctors are here, because I think obstetric is one department. I think, as Ravi was saying, you deal with 2 lives. Yes, it is very precious for the family of patients and their attenders, but also medically also, like obstetric is one of the most challenging fields, I think. Even in my critical care in New York and all, when I first saw like pregnant women, was always any call, if it comes, it was very high risk and very high stress for everybody, because even medically also, everything from intubation, physiology, and say, for example, I was pulmonary critical care. So whether asthma increases in pregnancy or decreases in pregnancy is, okay, so roughly I thought 1/3, maybe it increases, 1/3 it decreases, 1/3 it remains the same. So roughly, maybe I thought, okay, 1/3, 1/3, 1/3, because in pregnancy, everything from IBD, do you think, Santosh, it's the same? Maybe? Either it flares up or it resolves, or in like our rheumatol is, yeah, I think it's probably it is similar, because it's a little unpredictable with so many physiological changes, hormonal changes and all. It is so tough. So if Chinababu is here, yeah, he was here. I think he was doing a great AI conference coming up too. Like Google Health CEO is also coming. So I think next week or something we are having this. So that's a great conference, but maybe we'll ask him to involve in AI to see if he can solve this pregnancy issues. Like, can we simplify it? I don't think so. We still need doctors' full expertise here. So, yes, because of so many changes, challenges are high. So I think sometimes we need specialties from everywhere. So I remember recently we had a patient with refractory seizures. I thought preeclampsia, eclampsia and all, it will resolve soon. No, but it required so many, like at least 6 or 7 anti-epileptics. And after that, I think they tried different things, including electroconvulsive therapy and anesthetics, and I think, yeah, this so many 5 anti-epileptics, electroconvulsive therapy, and like high anesthetic agents and everything. Also, I thought the patient may not make it. I saw her after 10-15 days, but surprisingly, I think I've seen her at that time on ventilatory bed and all. She looked very bad. I thought she was all, yeah, if she recovers also, she may not make it with reasonable neurofunction. But I think Dr. Subha Chaudhary and the team and obstetric team was fully involved in that patient. And finally, after 6 months or so, the patient is completely normal. She's doing her job also. She was a software professional or something. And but this is only because of a combination of great work from obstetric and critical care and neurology and multiple other specialties. So Dr. Sunita is here. She is saying, I thought radiation is not there for pregnant women, but just after delivery, or no, even during pregnancy also. Even, if you have, that's one thing also I remember, because any drug in US had the FDA warning for whatever, either B, C, D, or E, or something like that for pregnancy, because almost anything, we don't know what side effects it has. But on the other hand, if it is required for the mother and all, definitely it is required. Even steroids for asthma and those kind of things. So radiation also during pregnancy also, probably we hope it is not required, but if it is required, our MR Linac and all is the most precision. This is the only one, this is the first in the country and maybe the world's 20th installation in Asia Pacific, second or third installation. So MRI technology with linear accelerator is like it will be more popular in 5 or 10 years in US, not even now. So it is approved by Medicare and also it is useful. So last thing, I will not take your time in this high quality sessions, is Hitec City. We have built it in was it exactly required to build this big hospital and all? Maybe not, but now we wanted to send a benchmark for any other hospital coming up now. It will be like this. So when my colleagues from US and all come, they are very shocked by seeing the hospital and all. They're thinking in India hospitals are some kind, but this is better than many average hospitals in US and all. And everybody is saying it's a 7-star hospital. Maybe initially we got a little less patients from Kukatpalli and all, because they are thinking it is too expensive looking at outside. But only the facilities and services is 7-star. The costing is 3-star, I think. Unfortunately, maybe it will come to improve a little bit. But we do work on volumes, and we wanted to treat the patients while giving the best service at the lowest price point also. And mother and child also, if you have some time, you can walk around the 8th floor. It is completely dedicated. One floor is like a big hospital equivalent here, and it has a dedicated lift, and also you did not interact with any other patients, and they have complete privacy with suite rooms, and some of the suite rooms open to private gardens and all too, because I know most of the obstetric probably doesn't involve much of medical treatment. So much for the hospital and ourselves. So, but I think this is time for having more high quality interactions. But my only request for the young and upcoming graduates is, please try to make it a little interactive and ask questions, practical questions. Sometimes many of these things may be on YouTube and all, but real life scenarios is little different from YouTube. So you have all the leading experts from throughout the city here. So make it a point if you having any issues, or even otherwise also, just networking and interacting with people, and they'll be more than willing to answer any of your questions. Including if you want to ask me, which is the best department for Yashoda, maximum growth is coming from the mother and child department. So I can give you the EBITDA and profit wise, you're in a good field too. So thank you. Have a good time.